What are the different types of substance use treatment programs? If you could explain that.
Yeah, to put it in the most basic terms, there's a lot of nuances to it when you look at it from an expert perspective, let's say. But from just a layman's terms, there's residential treatment and there's outpatient, and there's various forms within the two. There's usually, when you're talking residential, that means staying overnight. You're talking about a residential detox, which is a place where someone would go who's in active withdrawal, which would mean physical symptoms related to using a drug on an extended basis. And the other form of residential services is short-term and long-term residential, which really just differentiates by level of how long you stay for. So that's really for a person that kind of needs to get out of their environment or has a medical complication with the withdrawal symptoms that really needs to get that 24/7 care. It's, when looking at it at a medical model, it's almost like in a medical world, it'd be like the equivalent of surgery, like going into the hospital to get something taken care of in the hospital. Whereas outpatient, there's a lot of outpatient options as well. An outpatient, you don't stay overnight, but you could stay there. You can attend for various levels of stay. And in addiction, the most two common are just regular they call traditional outpatient, which is usually coming in once or twice a week for an hour or so at a time. A group, it could be an individual therapy session, could be a family session, any combination thereabouts. And then what's called intensive outpatient, which is 9 hours of treatment a week, which is usually 3 group sessions 3 times a week for a total of 9 hours. There's other levels of care, but that covers the vast majority of treatment options out there. Usually when anyone is confused about that, I would direct them to just get an assessment and let somebody direct you in which way you think you should go. And if you don't like the first opinion, you would do what you would do with your medical doctor. If your doctor told you you needed surgery, you're like, I really think I can do this, with physical rehab, you'd go outpatient. So get a second opinion if you need to, but consult with a professional and find out what's best for you and your circumstances, which is what my best advice to anybody in that situation.
No, that's great. And that was going to be our second question, is to how do you determine what your appropriate level of care is? I think you did answer that. I don't know if you have any other advice in terms of that and looking at the different levels and what's right for that individual person.
Yeah, you have to be careful. I tell this to everyone about people that sometimes have an agenda. So like you would the same way with if you were having someone to come out to fix your house. You can have a plumber come out and say, oh, look at it and be like, oh, you need the whole thing redone, and that's going to be $38,000. He might be just trying to make money, whereas you might have the second plumber and go, no, you just need to fix a few of these pipes here for, a tenth of that price. So you have to watch out for that. You can, so that therefore a second opinion can be sometimes, especially when you really get that feeling like, oh, I wasn't expecting that. This person told me I need to go away for 90 days. So be mindful of that. Fortunately, most people are in this field for the right reason and want to give an ethical assessment, but it's not always that. There is some money making situations to be made. So I would always caution anybody against that.
That's excellent. Thank you. To go a little deeper into when a person does start to get treatment, what basically occurs at an intake appointment, say their first appointment? What is usually the protocol? And I know it could be different based on the different levels of treatment, but what would be a general type of intake?
Well, an intake, so most agencies are somewhat affiliated with some form of government in some way. So with that, there is usually a little bit of paperwork, sometimes more than a little bit. I know at CPC, we have county, state, and federal funding. And we do get our fair share of paperwork. So you got to fill out some forms, kind of like you would do anything, though. You're enrolling pretty much in anything. There's going to be some forms involved. But then the clinical piece involves seeing the therapist. The therapist can hopefully involve your family if you want. It's better to have family. And you don't have to do the whole thing with your family. You can do some with, some without, kind of mix and match, whatever you're comfortable with. But sometimes getting the family, the wife, the husband, the girlfriend, whatever, the brother, sister, involved really adds more perspective on things. But you can do it alone too, whatever works for you. But really, it should be agencies are supposed to be client centered. So they're supposed to meet you where you're at if you're the person seeking help, and look at your situation as unique as opposed to like a cookie cutter situation. Like this is what we do, and forcing the round peg into the square hole. So people should be ready to at any agency that you're going to go to work with your situation. You might have young children at home that need to be taken care of. You might have a job that you can't get away from. You might have no insurance. There's a million things. So the intake should be, whoever's doing it should be ready to work with your situation and get you into the best possible situation for you based on your circumstances. And also, financially as well. You don't want to break the bank. And I hate those sob stories about people that, have shelled out all this money and then didn't get the results they wanted to. So, there's plenty of places with grant funding that take insurance that you can get a reasonable treatment for an affordable price.
Thank you for that overview. Is there something else you wanted to add?
Yeah, and the other thing is, addiction doesn't exist in a vacuum. It's an assessment should be a comprehensive assessment. Like at CPC, for instance, we do a full biopsychosocial assessment, which means we're looking at the social determinants of health, not just addiction. We're looking at your family. We're looking at your employment. You might have housing needs. Maybe you're about to get evicted, or unemployment. These, and of course, the most important is mental health. Integrating mental health into the assessment as well. So you want someone who looks at the whole picture, not just drug use, not just the drug and alcohol history, but looks at how all these things interplay so you can get the most effective treatment modality for your needs, whether that be adding in a psychiatrist or, various specific groups like trauma groups. So you want to be able to go somewhere that's going to be able to kind of give you a more comprehensive, a broad array of services based on what you need.
I just ask, I'm sorry, Linz, one more question to that. When it comes to the intake appointments, does it cost any money to do an intake with one of these places, or is it free?
It depends on the place. Some places, you got to pay cash, some you got to use insurance, and some have grant funding. It depends. It depends on the place. Most places have invested the time to get insurance, to at least have insurance coverage, and Medicaid over the years has kind of expanded. So there's more people taking Medicaid for addiction treatment, which is one of the most common insurances out there in New Jersey right now.
Is a level of care determination also made at the intake?
Yeah, that's the goal of the intake. You want to leave the intake with a good picture of what's the game plan. In the best case scenario, right then and there. Sometimes it's like a slam dunk. The intake is over, and you say, hey, this sounds like this intensive outpatient is just right for you. And you explain it to the person, and they're like, yeah, this is just right for me, and they go. And that happens a lot, fortunately. But sometimes you have to go back to the drawing board. Well, the hours don't work for me. I don't have transportation. But the person who does the intake should be following up. That's general protocol to follow up, and if not, find somewhere else that's appropriate. So sometimes, like in outpatient, we get somebody, we do the intake, and we're like, we'd like to help you, but you really need a residential program, and we'll help the person get linked to a residential program. And the good thing is, when they get out, we'll be right there waiting for them when they get out to continue with the outpatient.
So to then service after they're discharged from an inpatient to service them with outpatient treatment.
Yeah, that's the standard step down from inpatient, is to go back to outpatient.
If you can, I want to see if we could kind of go through each of these types of programs. If you could just generally tell us, what occurs, at each program. So if we could start with Detox. For our viewers out there who may not be familiar with that, what happens at Detox?
Well, Detox, the goal is stabilization. So the primary goal of Detox is when you leave, you are medically and physically stabilized. So you're no longer experiencing withdrawal symptoms. That's the ideal goal. Sometimes you'll hear people still having some mild withdrawal after they leave, but the vast majority is over. Ideally, most people leave and feel way better. It all depends on the course of treatment and the medication and the client preference. There's medications you can continue to stay on a maintenance basis, outpatient, which will eliminate the withdrawal depending on the drug use. But the goal is stabilization. But there's also education and a kind of like a starting point, setting the foundation to build motivation and a buy-in to the treatment process. If you talk to anybody at Detox, clients come in pretty beat down by the world by that point. In Detox, they've been using pretty heavy. They've been on a run. All kinds of consequences have piled up. So there's not a whole lot of therapy that goes on in Detox, but it's more of a like educate and motivate and point in the right direction. And then in the follow-up, that's where the more of the deeper therapy starts.
What would you say to those people who believe they could detox on their own?
I would say it's a dangerous move. I mean, you're better off getting professional help because there are risks involved with that move, especially with certain drugs. I mean, when you're talking about alcohol or benzodiazepines, which is like drugs like Xanax, Valium, there's actually a potentially fatal seizures situation that can happen even weeks after your last dose. So it's better definitely with those to get the professional. Opioids, people try to do it on their own. We're having a lot of success with outpatient detox for opioids. It's also available for alcohol as well, but there's not as many medications available for alcohol right now as there are for opioids. So people do detox outpatient as well. But I would definitely, at a minimum, get that assessment and I'd recommend, doing it the safe way. The general rule in life, safety first. So I think it's best bet to try to get, because if you fail, it could be.
There could be lethal consequences.
Yeah, and you could really regret the decision, or if you get sick or whatever, you might have another condition going on medically, so.
And then you had talked about both outpatient and inpatient treatment. So if we could break that down, we could start with inpatient if you want. What happens, typically at a short-term inpatient versus a long-term?
Well, I've been an outpatient for the past 25 years, but I've sent plenty of people to inpatient. But from what I know about a short-term inpatient, it's an extension. It's building that foundation, getting the person linked. When that person leaves, they should have a good foundation of what recovery is, what it entails, coping skills, relapse prevention skills, what supports are out there, and how to deal with high-risk situations and triggers, and also a basic understanding of what's going on with any co-occurring mental health issues, whether it's depression, anxiety, bipolar. So a lot of times they start clients on who are appropriate for medication in the inpatient. So that, it's like building a strong foundation so that person, when they go out into outpatient, they're ready to stand on their own and kind of prevent relapse and engage in an outpatient program without continually going into a crisis.
And inpatient, whether it's short-term or long-term, it varies, right? The length of stay can vary. Is that correct?
Yeah, there's a lot of factors. I mean, finances is definitely a factor. I mean, sometimes, your health insurance dictates how long you get to stay. So agencies have been worked with that system to the best we can and do what we can in the time we have allotted. And I know everybody tries to get the length of stay that's appropriate, and do the best we can with what's available. So in the long term, obviously, you get to do a lot more longer term recovery type things. You really when you get a few months under your belt, you can start getting into deeper issues and really get into like more of the trauma and the deeper mental health stuff, and different things that may be kind of triggering the addiction. So you can get a little farther with that in a long-term residential program.
So a short term, it's more like weeks to a month, and then long term it would be considered a few months, 4 to 6 months. Is that right?
Yeah, that's pretty much it. Yeah, sometimes 3 months, depends.
Yeah. And you were telling us that you've been in outpatient, you said for 25 years. So talk to us about intensive outpatient and outpatient generally, what occurs at each and the length of each program if you can.
Yeah, so we like to say it's client driven. So I'm going to give average numbers of length of stay. Like, let's start with intensive outpatient. It's on average 12 to 16 weeks. I've seen people complete faster, and I've seen people stay longer. But that's like the kind of the mean. Most people fall within that 3 to 4 month range, and obviously there can be a step down in frequency in that time period. So in an intensive outpatient, it's a lot of group therapy, and the group therapy in a good program should vary. It shouldn't just be addiction. Throwing in mental health, bringing in different guest speakers. Like at CPC, for instance, we have recovery supports come in. We have 12-step meetings come in. We have people from our supported employment programs come in. We even have medical personnel come in. We have the Narcan people. So they're getting a wide variety of topics so that the client doesn't just know about staying sober. They know about managing anxiety, dealing with stress, dealing with depression, dealing with mood swings. And people are ready for all those things because it all adds up. Recovery is about a holistic approach. We even have yoga in our IOP as well, to try to bring as many different angles that we can to prepare people as adequately as possible, so that one day they can deal with function with just community supports without relapsing.
That's good. If I'm a loved one and I know someone who is suffering with an addiction, and I've finally gotten them to agree to get the assessment, how quickly from the moment they decide they'll do it, is it easy to get a quick appointment? Like, I'm afraid they're going to change their mind in 24 hours. Do programs do that? Will they accommodate that tight schedule?
In a perfect world, it would be great. Like in the children's world, they have children's mobile response. They come out within an hour. We run that program for CPC. It's a mental health and substance use, but they don't have that for adults. But in the 19 years I've worked at CPC, we never have a waiting list for addiction. That doesn't mean we can get you in tomorrow, but usually means we can get you in within 2 weeks for an outpatient assessment. But I've had people, call me and say, like, look, please, this is like my one shot. I'm a little bit of a softie when it comes to that, and I'll even do the intake myself quite often to try to help somebody out. In fact, I'm doing one this week in that very scenario. You should be able to get somebody in within a relatively quick time. Yeah, in a perfect world, anybody some billionaire wants to invest to have like a go out and assess thing, that would be amazing. So
Yeah.